Yo, what's up, man? This your boy D with On the Porch. And like I said, y'all, we here this weekend. And I got something special. Just like I did all week long showing y'all. We was in Dr. Sand's office. I said that right?
You did.
I said that right.
Sand's Aesthetics and Plastic Surgery.
Yes.
I ain't even had to say that. But we was over there in his office this week, y'all, and y'all saw it. We about to really just jump into some stuff, bro. That's just like, I know a lot of people in our culture don't understand it, and a lot of people in our culture think there's something wrong with it, you know. But we about to jump into cosmetic surgery, injectables, well, Botox, you know. What else? Skincare, definitely.
Sunscreen.
That's
for black people.
For black
should have brought you something today.
But hold up, time out. My thing is, black people, we always thought we need sunscreen.
We do.
And I am a board certified nurse practitioner.
Okay.
You want to make sure that you wear the skincare, the sunscreen before you go outside in the morning. Just like you. Your head is exposed. Right, any sun exposed area. Seriously. You don't want to end up with any type of skin cancer. And it is very common. So people think that we're immune to it, but we need sunscreen as well. Right. Yep.
So without further ado, let me introduce y'all to who I got on this porch, man. Straight out of Dr. Sand's office, I have my girl Amber.
Hey y'all.
Look, she was all in the footage. You know what I'm saying? I'm trying to figure out what I'm gonna do with the rest of the footage I got. You know what I'm saying? She was all in everything in the office. And I got my girl Shay. We just meeting for the first time. How you doing, Shay?
I'm good.
Are you good? You all right?
I'm fine.
You sure?
I'm positive.
You sure? You got your fan blowing on you.
She got her Beyonce on.
I'm trying.
You try? That's the purpose of being on the porch.
I know. I'm a country girl, so.
And you don't like the porch?
I do. But
didn't you grow up? I'm saying, remember growing up?
I grew up in Darrow, Louisiana. Okay, everybody does that. So you know where Gonzales is?
Yeah.
So it's a little country area on the street. Get off in Sorrento. You go down, you won't miss it. Because if you blink, you will. Just keep driving. Highway 22.
Damn. All right, country girl, I need you to talk up a little bit.
Okay.
Oh my God. But anyway, man, we about to go ahead and jump into this thing. And so first and foremost, just like you were saying, just like y'all were just saying about our skin, one of the biggest things in our culture, we think because we're dark skinned, we're black, we have melatonin. Melanin.
I am highly melanated right now.
Where I got that from? I don't know.
To sleep. Melatonin is medicine.
Sleep.
Yes.
Yeah. Melanin. I said that right?
Yes.
So we think we got a whole bunch of it to where we don't have to.
Crack.
And we don't.
But we do. Black does crack.
That's what we're going to talk about Botox today. That I actually have in my face.
Yes.
Oh.
And I did Amber's face. But Amber has a little bit more.
I have a little bit more. We'll talk about that too.
We'll talk about that. But I have Botox. And I can still move my face, make expressions. Yes. But I like the smoothness. And when I put my makeup on, it sets a little bit better.
Wow.
And it gives you a refreshed look. So I like it.
Wow.
Shook, right?
Wow.
A lot of my clients come in doing the same thing. They're like, you got Botox? Let's talk about it. So.
Wow. So all right, since you already there, let me know what is the purpose of Botox?
So Botox is a neurotoxin.
Okay.
And it is very safe. It's been out since the 1980s. There's a lot of research around it, but it actually relaxes the wrinkles in your face. So I use it here for your frown line. So like if you frown, if you raise your forehead and you have your forehead wrinkles, sometimes people have wrinkles around their eyes. Sometimes people have TMJ and they just want to kind of smooth out and release those muscles here. We'll inject it there. Somebody don't like their chin sometimes, so they have like the chin dimples. Mm-hmm. We do that. So I'll use it there, but it just smooths that area.
Oh, it just smooths. It just make everything look.
Yes. Now it's used for other areas too. So like people with migraines, so in the medical profession, it's used for migraines, and it's great because it does help release those headaches. But that's something the neurologist would prescribe and apply. Yeah. But we use it for underarms for like people that sweat a lot.
Hyperhidrosis.
Yes. So we use it there. We'll also use it sometimes for TMJ. I just spoke about that, but it not only helps with TMJ, but it slims your face. So
All
people
right,
like that double
so
benefit.
so wait, you keep saying TMJ. I remember you on the porch. You gotta break it
So
down.
people call it kind of lockjaw sometimes, and
Okay.
they're like their teeth grind at night, and it just they crunch, and it feels like it's real tight here. So when we inject the Botox, it releases those muscles and relaxes it, and it helps to, like I said, help that, but it also helps slim your face as well.
So in other words, so Botox, it sounds like Botox really just helps relax your muscles. Really.
It does, and helps the wrinkle appearance.
Okay.
It's not a frozen look. I know that's the misconception that you're gonna look like that, but you don't.
People like frozen sometimes. So like if a patient comes in, they want Botox, what we do is first of all make sure they're a proper candidate. So if they're coming in, when they sit in that chair, they're not just a client, they're a patient, because I'm a nurse practitioner, so I'm always looking at the aesthetic component, but I'm also looking at the health component. I just make sure they don't have any contraindications.
Okay.
So we'll talk about what they want to achieve. If they want a natural look where they still can move, we look at the different dosages of where we're going to place it. I mark my patients. Everybody's not the same. We look in the mirror and we look at the goals that they want to achieve. Once we talk about that and we agree upon it, I'll mark them. I place topical numbing cream so they can be comfortable. We place the injections. It's real quick, and then I apply ice at the end of it.
Damn, that sounds real fast.
It
It's
is.
quick.
30
I promise
minutes.
you.
30 minutes?
It's less than 30 minutes. The 30 minutes is mostly education about it and making sure they don't have any contraindications. And I do pre pictures before they get their injections, because I want to make sure that we can see. So I make them do their expression, so when they come back in 2 weeks, they can see my wrinkles are gone. Yeah. So
Wow.
The biggest thing is all of this, what we do at the office, most of it is education.
yes.
Right.
And that's the big misconception. People think they're going to like these factories like they have in Miami and Mexico, and that's not like that here.
No, and I'm an educator because, like I said, I'm thinking about the healthcare outcomes. We teach them a lot about discharge, so I always have somebody follow up in 2 weeks because I want to make sure if I need to do a touch up and make sure that where I place it is where they wanted it. So,
Okay.
yeah.
So in other words, so what y'all doing in the office, y'all actually, I guess y'all actually trying to make it seem like it's real versus have people coming out look like the conception.
So I'm enhancing what they already have. I don't want anybody looking fake. I don't want anybody looking like when you walk out, oh, you got work done. No, and I work in unison with not just Botox, but sometimes we add fillers to the assessment as well, as that if that's what they're looking for. So fillers help with volume loss. So I've placed filler in her cheeks. We've done her lips. I've done Botox in her face. So Botox here. Yeah.
But what I'm saying is it looks natural.
It looks natural.
I'm talking about you. All your face still moving. You just see how you just did that. All your face.
There's the education around it. I'm telling you.
Now, if you ask my 16-year-old if I'm fussing, she's like, "Are you fussing?" And I'm like, "I don't want you to know if I'm fussing or not."
I can look at somebody and they can't tell if I'm upset, right? I mean, I'll still frown a little bit, but you really can't tell.
Right.
And Botox lasts 3 to 4 months, but it lasts on me a little bit longer. But everybody's metabolism is different. So if they work out or if they have a high metabolism, it can wear off, but it usually lasts 3 to 4 months.
I'm 3 months. Religious.
I've been since January.
But it looked natural though.
Correct.
I'm talking about like.
And we have a spectrum of patients. So people come in, they start in their 20s. We have people elderly, but again, it makes them look refreshed, and that's the look I want. That's the look I want them to have. So,
Wow.
So Aunt Sally is coming to get Botox along with Grandma, along with your sister, along with your mama.
along with the college girl who won't
Correct.
and I place it. So it depends on how much they need.
Mm-hmm.
If people start getting it early, they may need less dosage. But as they get older and they have more wrinkles, I may need to adjust the dosage. But
You know what we should tell them about? You know, a lot of people think that once you start, you can't stop, and then you're going to have more wrinkles.
and that's absolutely not true. So there's no addictive properties in that medication.
Mm-hmm.
However, the addiction comes when they see the results. It's like, oh, I'm coming back. I was in a restaurant yesterday. Somebody was like, Shay, look. I was like, all right.
I see you.
Right. So that's the addiction around
That's
it
the
because
addiction.
they feel refreshed. And even it's just a subtle change. I'm into, again, enhancing what they have. I don't want anybody looking like, oh my God, what happened? That's my results. That's my
Right.
reputation.
Right.
And again, I want them to be who they are.
Man, so
It's beauty inside and out. It's not
Right.
about just
right.
inject. And look, before we talk about injections, we also want to talk about skincare, because I will not inject people if they're not on appropriate skincare. You have to make sure that what I'm injecting in is a clean canvas. So we have skincare products at the office. I use a skincare routine at home. We have hydrofacial at the office, which is amazing. So if you don't have one, you need to get one.
Because men do it too.
Yes, men do it, and it's great because it exfoliates your skin, it cleanses it, removes dead cells, and it also infuses moisturizers.
But this is how it works. You know what I'm saying?
Right.
You
need it, though.
Yes.
I'm talking about.
You need it.
So.
And I told you the gunk.
Right.
You see what's all the impurities in your face.
I love it. I always wait to see what that looks like.
How often would you say you'll have to get something like that?
So a hydrofacial, I recommend at least 2 weeks before they start injections, so they can always have their skin prepped and primed. But if you get injections, I recommend patients to get it once a month so they can keep their skin, and the results last longer as well. So it's basically injecting into a clean canvas.
And then I talked about this a little bit earlier on Dr. Sand's Instagram, but like when you have an event coming up, you really want your makeup, you're paying all this money for makeup, you want to make sure that it is going on smoothly, that it's on point. And my makeup wouldn't look like how it looks right now without a dermaplane and a hydrofacial.
Okay.
Because my face is clear, it's clean, it's a
The hair
canvas
is
for
off, yes.
off. It's a canvas for not only her, but the makeup artist as well.
Okay.
And honestly, once I get my hydrofacial, I don't want to put anything on my face because my face is so
Glowing.
It's glowing. It really is. So it has a nice complexion afterward because it's bright, it's clean, it's amazing.
So, you know who hopped on hydrofacial? J-Lo.
Yeah.
She has a perk where it heightens their beauty even more.
I wish I had a machine at my house. I'm serious. I mean, because honestly, I do my skin routine at night. So I do the gentle cleanser. We have ZO products. We have other products as well, but I use ZO, and I use a gentle cleanser. I do the exfoliating polish, and I put a moisturizer on, and then I have some serum I put on at night. In the morning, vitamin C, skin, and the sunscreen
Acts as a primer.
As a primer for your makeup. So you really, it's not like you're going out, you got to put sunscreen. It's not white. It's skin tone based. You can put it on under your makeup. I use it, but again,
you're not casket ready.
Exactly.
Damn. Say, you know what though? But it's crazy because everything y'all telling me, I'm like, damn, I never knew y'all go through all this just to get makeup.
Oh wait, it's not just y'all. Men do it too. I have injected cheeks in men and lips in men. Yes. Botox for sure. Men Botox
they love a
just a little bit.
jawline.
Yes, everything.
Jawline.
I've done it all, and they look natural. Yeah.
Dr. Sands does too.
Wait.
We have to try the product so we can know how it feels and really educate our clients.
So what you mean the jawline? Like,
so this is your jawline. So filler. Now that's not Botox. That's filler. So basically, it's just filler being placed here along your jawline. So it kind of snatches it, makes it more defined. And then I'll also, if I'm doing jawline, I add it to the chin because you want to make sure you have that right dimension and balance. So.
Are you shocked? You seem stunned.
I can do Botox on you if you need. See? Oh,
there we go. Candidate.
Trust me.
What you say? What the? So tell me what the hell?
I don't want to say that. I don't want to say that like if you feel like you great.
No. I'm just saying. What would I need? What's going on?
So your skin is already great, but I would definitely do Botox. So you would need Botox in your forehead. Frown for me, and then smile. He has crow's feet too. So yeah, you would do a full face. So that's a little wrinkles around the line, but I would definitely do a full face on you.
Really?
As far as Botox, yep. And Botox comes in units. So when we do units, usually on the forehead and the frown lines, you use about 20 to 24 units, but it depends on how strong your muscles are pulling. So it just depends.
Really?
Yeah.
What y'all think? I need to fix some of this up here? Y'all think so?
He's coming to Dr. Sand's office after this.
You need to try it so you can come back and tell people how it feels. The hydrofacial and the Botox, I promise you.
Game changers.
And I'm usually there on Saturdays, 9 to 1, because we have Saturdays with Shays. So
because we know it's hard.
Yeah.
It's hard for the working parent to take care of themselves.
I didn't know, but damn.
And I work during the week too, so Saturdays is great.
It's a crunch.
So I will tell you, patients have said that it feels like a little tiny stick or maybe like a bee sting, and some people say they don't feel it at all. The people that get it all the time, they usually don't ask for numbing, but I always numb my patients because I want them to be comfortable. And it's just topical. Yeah,
it's an experience.
If I can do it, you can do it. I promise you, because I can start IV on patients. I can get I can do that to anybody, any day. But I don't like getting stuck myself. But Botox, I will do. And Michelle, who you met, Michelle does my Botox, and I do a Botox.
Okay, yeah, because she was sticking the lady in there. You know
that was mind blowing, right?
Yeah, it was. I liked it, but you know what? I was kind of like, as I'm doing the editing and watching the video just over and over, I'm looking like, good, that needle. It's something about a needle
short. It is very short, and that whole needle does not go in. It's literally like a sub-Q injection.
Right. No, I'm just saying for me, that needle for me is like, oh, and then around my face is like, oh, you know. So.
And we use different, like if I'm doing different areas, I'll prep my needles to make sure that they're different because I don't want that to be doggone in your skin. So I change my needles if anybody's uncomfortable, but I usually have my little routine.
Y'all have to strap me down.
Same for filler too.
Y'all have to strap me down to be like, man, strap this clown down right quick before you start moving around.
I think you should go and try it. You're going to get addicted to it.
Think so?
Yeah. 100%. Pondering.
You can't see your jawline with your beard, but it's already a little defined already, so.
I'm ready for my close-up, Mr. DeVille.
Yeah.
All right. So look, all right. So the Botox, and you touched on the fillers. Y'all got the fillers, the Botox. What else is some of the things that y'all offer in the office?
So we offer, I call Dr. Sands a body contouring specialist because it's more than just going into the operating room. It's education first. He's going to go in with the patient. He's going to talk to them about their health concerns first because we got to make sure you're the proper candidate. Whenever you go to some of these other places out of town and out the country, you're a number. With us, your family. So he's going to go down the list. So we offer, as you were playing with, the breast augmentation, which are the implants.
And I also give that to my patients to hold on to. So like if they need that to squeeze or they get the injections, it's
right there.
I know, huh? That's it. Just squeeze.
Absolutely, just squeeze it.
And it won't bust, so we're good.
Nope.
They can squeeze all they want.
You can run that over and it's not going to bust.
Really?
With a car.
It's inside of our body. That's why they're implants.
So.
You want to talk there first?
So that's another thing. That's another thing. Just in our culture, right? That's another thing.
You would not believe the people that come.
No.
And look, and because of patient privacy, we can't say, okay, this person came in. But people of color get these procedures. And I just want to say this and kind of add this in. Dr. Sands, I would not work for him if he didn't have ethical, moral standards. He's an educator. He explains procedures to patients. He's not going to just say, okay, we'll do it. He's going to make sure you're a proper candidate. And that's what I love about it because as a provider, we're always thinking about the healthcare outcomes. This might be a nice procedure, but if you're not the proper candidate, if you're not pre-opped appropriately, you can have complications. And that's why he's very detailed. And he gives those different consults before we do any procedure because he wants to make sure that you're right.
And even so, the patients that don't necessarily meet those requirements, he has them meet with me so I can go over the educational piece with them.
Yeah.
We don't want to turn you away. We want you to understand the why. And that's the thing. A lot of people don't give the why.
And provide options.
Correct.
Right. No, well, so, you know, the first thing we done, because I thought it for a long time. And matter of fact, a couple of friends of mine after they saw the video, the first thing they told me, "Boy, look at you playing with some titties." I was like, "Come on, y'all, it was all for the shot," you know. They're like, but they was like, and a couple of people I knew, they was like, "You don't think them things busting them women?" I was like, "Nah, bro." I said, "This is what I was told. I told they once they put them in there, they ain't no such thing as busting unless you going to." Somebody who don't know what they're doing, or somebody who putting some bad product in you. And I'm saying that to say, in our culture, we think with breast enhancing your breast, enhancing your buttocks or butt or whatever you. I said that right.
You did.
Your gluteus is your buttocks. I'm trying to be professional, right? But enhancing all these things, we think it's stuff that's put into our body and can one day just burst or cause complications to us to where it's like, oh no, I'm not putting that in because I'm gonna start leaking and I'm gonna start this. So,
but if any complication comes up, that's why you go to somebody that's board certified and know what they're doing because nobody's perfect. Even with fillers, Botox, I always talk about People come in, they're like, I'll sign a consent. No, let's talk about it. Because if you have an emergency, I want you to know what the emergency looks like because we can handle it and you need to call so we can do this.
Versus if you're out of town, you don't have that care.
Exactly.
They're thousands and thousands of miles away. But I want to touch on something that you were saying. So a lot of people think when a lot of women are getting butt augmentation, luteal augmentation, Brazilian butt lift, that they're putting a foreign object in there. You're putting your own fat in there. So you're getting liposuction 360, your abdomen, your flanks, your full back, and then that fat from there is going to the butt.
In a sterile environment.
In a sterile environment.
Yeah, when
in
you
an operating room.
Right. So you're not going to somebody's
an accredited operating room.
Somebody's carport or
correct.
So answer this here. You saying you putting your own fat in there. So why in the world some people's butts and stuff be hard as a rock now?
Well, that's probably because they've used different things. So if they're not doing the 360, there is silicone implants. And you just got to be careful because, again, if you're going to someone that's out of state, you come back here, you have a complication, they're out of state, you go to another doctor and want them to fix it. They don't know what's been placed in. They don't know what procedure was completed. So you may have to have like surgery to get it extracted. So
and there is injectables that Dr. Sands does that he places that for small enhancement in the butt area.
So we have filler that we can use to if somebody doesn't want to have surgery, there is filler that can be placed there.
But you have to make sure you're going again to a board certified person because if you're going on the back alleys, then maybe
seriously, people
semen,
like
seriously. Wait. Tell me, that's true. They really put semen in
it. They can put whatever they want.
They can put whatever they want, and then you don't know.
People getting products that's not from a valued source or a reliable vendor. If they get it from out of the country and they just get it online, and you're going somewhere that you're not supposed to, and they're injecting that, you are putting yourself at risk.
Wait, so they really put this stuff into people?
Yeah.
So this ain't a joke we see on social media or see on the news.
That's
they
real stuff.
really put.
So Botox and filler, you have to be number one board certified, whether you're a nurse practitioner, PA, physician, dermatologist. We have to write that's a prescription. That is a prescribed medication. So it's not like we can go to Winn-Dixie and pick it up off the shelf or go to a pharmacy and pick it up. You have to have a license for that.
Wow. Damn. So that's
the more you know.
Yeah, I feel like I'm on NBC in the morning where they like the star come flying through. The more you know. So okay. So with the that was the fillers and the Botox, right? So what are some of the I guess the next thing, what are some of the reasons or why some people some women will come in and be like, well, I want to get enhance my breasts, or I want to reduce them to what they want.
We have women and men from every walks of life.
Yeah.
We have massive weight loss patients who have been on this journey for a very long time, and they want to match what they see in the mirror. So they want to match, they want their breasts lifted after the massive weight loss. They want their tummy area repaired after black skin after massive weight loss. We have the working woman who may have been having back pain her whole life, carrying a backpack because her breasts were enlarged. We're reducing those. We have men have sometimes they have glands that cause gynecomastia, that has little fatty tissue underneath their breast area and their chest area, and so he removes that as well.
So the excessive tissue.
Dr. Sands, I'm telling you, he is really and truly about everyone in every walk of life. We do transgender surgery, top surgery for And
then sometimes when people have breast cancer,
correct, he does that too.
Breast removed.
So he does
everything. Want to rebuild or reconstruction.
Okay.
So
Dang, do that too?
Yes, he does everything. A body contouring specialist.
Really?
That is our boss. Wow. So, and he, like I said, and then you have someone who is like me and a mom and who has had 3 kids and, everything's just
or twins,
and everything's not necessarily back in its place. And so we have surgical and non-surgical.
50-year-old twins.
Yes.
Oh, they 13. These twins too. They 13.
Y'all are? I love it. Best of friends, but no but the surprise.
Yeah, do they?
All day. I know. I'm a
do
boy
they?
and a girl, so
The other day we was in the store and I said, y'all get some. I said, y'all get something to drink. Corey picked up, I want to say it was cranberry juice. Kelsey was like, nah, I don't want that. Corey was like, well, what you want? Kelsey was like, I want this one. Nah, I don't want that one either. I said, you know what? I'm going to make the decision. So somebody, if y'all don't come up with it, I'm going to do it.
Oh no,
you know what I'm saying?
All day. But I love that they have that relationship. But like I said, they know what buttons to press, but they're the best of friends, and they have that support
Together forever, right?
So,
but yeah, so they have them. They have you have every walk of life. But I touched on something that you want to.
No. What I'm saying is, we used to talk about what you said. Damn, I forgot. You said, something out of place and you just won't get it back.
Right.
I'm like, wait, hold up, what you mean out of place?
So after women have babies and children, there is something called your muscles are there. I'm talking about the muscles. I'm talking about the muscle diastasis. Mm-hmm. So some women end up having like black skin right here. Some women have muscle diastasis, which is the ripping of that. So Dr. Sands will remove the skin, tighten it back up. Tell me. Men too.
No, not just that. We on the porch. We up
them names.
Oh yes, sorry.
Yeah. Let's call it what it is.
Sorry.
The
fupa. And then you know how you feel like you have this big belly.
Yeah, come on.
Yes, sorry. I'm sorry. We were educating. I'm sorry.
I know y'all, but look, y'all, we on the porch, we uptown, all the medical terms, we gotta stop that right now.
Sorry.
We gotta stop those.
The muscles are like this, and Dr. Sands makes them like that.
Snatch.
Snatch.
That's what I'm talking. That word, y'all know that. All y'all know that word.
He doesn't love the word snatched.
Who porch y'all on right now?
Your porch.
All right, come on. Who porch y'all on right now? We gonna go with everybody knows.
Snatch.
So wait, why wouldn't he? Why? Okay, explain to me what's the difference. Why wouldn't you want to use that word snatch? It just don't sound right. It's just.
I think he just wants a different word to describe his word.
Yeah,
because he has a lot of pride in it. He has a lot of pride in it. We do have someone who talks about the sand snatch. And he can't get away from it. He's never going to be able to get away from it. The sand snatch. SS.
I like it. I like it. You know what I'm saying?
We should trademark it.
You think so?
Yeah, I'm going to tell
him. So, damn. So you get rid of the fupa and everything.
Yeah.
Wow.
And if you're hanging down here, he brings it back.
We call that the apron.
The apron.
I'm talking about the breast. You know, some people,
I'm talking about the stomach. All of it.
All of it. Wait.
All of it.
60 at the breast. I'm talking about when he's down there, they bring him back. Wait. So, all right. So, if in those procedures, the first and foremost, like you said, we got to make sure you're healthy.
Correct.
Because it is surgery.
So the pre-op evaluation is important. So he does medical evaluations.
You have to have a medical clearance.
Yes, and then he also starts you on some different things.
Oh yeah. So
surgery.
we do surgical vitamins before surgery because it's extremely important to have your body in tune before surgery. Mm-hmm. So you start those about 2 weeks before surgery, and then there's also creams that we have as well to help with the skin tightening for you as well before surgery.
Wow, because it is something major. You're going underneath the knife, then they knocking you out.
Correct. So not just pre-op, but post-op is important too.
Right. You have to take care of it.
Yeah. So you come back to the office. He has post-op evaluations. We have Michelle, who you met. Mm-hmm. She's also his nurse. She does her follow-up calls and follow-up visits to help with Dr. Sands.
You're with us for years. It's not just so he does. His follow-ups are 1 day. The very next day you come into the office to make sure everything's okay. 1 week, 3 weeks, 6 weeks, 3 months, 6 months, 1 year. So he's making sure. And in between that time, you become our family. So we're calling and we're checking on you. We're asking how everybody's doing.
They see you in the store, they're like, girl,
look, yes.
So wait, time out. So he do all that for when y'all go through when they have surgery, right?
And women and men. I gotta keep saying
keep saying that too because a lot of people think that's a myth.
Correct. Men have BBLs too.
And then also just really to contour their
abs.
Right.
I stressed you out, sorry.
See?
I'm causing more.
I'm already mixing my Botox.
Hey, look, man, look. Wow, I lost train of thought. Okay. Y'all done messed up. Y'all. Now I gotta. Right now I'm trying to refocus who gets a BBL, and I'm trying to. Girl, you didn't mess me up for
You're
the day.
welcome. You're welcome.
And you proud of that? Huh?
I am. You're gonna go home thinking about. You're gonna go Google it. You're gonna go on Instagram.
You know you're gonna
and start
call and make an
looking.
appointment.
Yes.
I'm there every other Saturday, not
Correct.
once, because I do work during the week.
Man.
This is the fun.
This is her happy place.
Yeah. Man.
And I think it's important that we have somebody in our community like Shay,
Okay.
with the education,
Okay.
with the just knowing this is a sister. Like she knows.
Oh yeah, she. Oh yeah.
knows
No,
herself.
no.
She knows her
Oh
stuff.
no.
And Michelle knows her stuff too.
Yeah.
No,
And
I'm
so
not-
does Dr. Sand. So we
I'm
have
not
a multifaceted office. So
I'm
that
not
makes
saying she don't, but when I pulled up and saw I was in the way I already knew. I was like, oh yeah. I was like, you know what? Oh yeah, you're right. She a sister. You're right. Come see.
A sister that used the work. I'm not going to profess something and promote something I don't believe in.
Right.
So that's why I use it.
she's real.
Right.
And then, like I said, I'm all about results, but I'm also about patient healthcare outcomes. Like that
Okay.
is
Right.
So okay. So because when you come into the office and you get any work done, from the Botox to filler to surgery, anything, y'all. What it sounds like to me, y'all looking to put quality
Correct.
over
quality over quantity.
right.
Every time.
I'm not trying to run through, and you can ask Amber. Somebody comes in, they're like, "Oh my goodness, you're talking about this?" I'm sorry, did nobody ever talk to you about what to do afterward, when you should return if this happens? That is beyond, like, it baffles my mind. But whether you're in that chair and this your first time or you're a repeat patient, you're gonna get the same discussion. Because I want people to have what they want, but I also want them to have the best results. So when they leave and they go home with their people come in, they're like, I've turned a patient away because they've been drinking the night before. You can't come in to see me and get injections and you've been drinking 24 hours into your procedure, because that can cause increased bleeding, bruising. We don't want that.
Right.
Now you can have that, but we don't want to increase it. So
Right.
Like, why would you risk that?
right.
So that's what I'm saying. Because you know how you can go some places and the doctor gonna give you whatever you want.
Mhm.
If you say you want something sticking out like this, he
They're
gonna say,
do it.
he gonna be like, come on, let's go.
Let's
I've had people be like, I'll pay you cash right now if you could just. And again, I'm about realistic expectations. So you can come in and show me the lips you want online, but if we're not going to achieve that goal, I'm not going to take your money. I'm going to give you, this is what we can do. If you want to build them up over time, but we're not doing all that in one setting. I want to make sure that you look natural. You don't walk out and you look unreal. But if you want to achieve a look, we can always build it.
Right.
But you have to give it time, because whether it's Botox or fillers, you need at least 2 weeks for it to settle.
Mm-hmm.
So
I guess that's what when you look in not just with our culture, but when you look at just people, men, women, people who do any kind of enhancers, sometimes they get to the point where it just look unreal, and you
and I
looking
have
like
to stop them. So
right.
it's education, and again, everybody's in their own phase, but it's education,
Right.
and giving people grace and patience, and then also telling them the why. This is why.
okay,
That's the big thing. You got to know the why.
right, because because to me, I feel like if you're gonna promote something, you want to promote something that looks natural.
Correct.
Yes.
And a natural look is better than looking like you belong in.
Like some people on subtle, some people like, look, I want my lips to be full here, and lips are my favorite thing to do. But I literally study what they say. We talk about what we're gonna do, and again, it's over time.
Right.
So some people will see a instant, because it's different. Fillers are different. They have some fillers that you use for like fine lines and wrinkles. You have some fillers that you're gonna get volume, plump. You have some fillers where you just want like that subtle change, or you want people to notice it, but you don't want to be like, okay, I know you got your lips done. They're like, I don't know what it is.
Something's different.
Yes. And then I get a text on my phone said, please don't ever go out of business. Please make sure my lipstick looks amazing now. Like, I'll get those texts. I just got a text before I got here. Somebody, I did their jawline. And they're like, I just want to give you credit.
This is your job.
Yeah. So
Wow.
we have an amazing staff. I
We
love
do.
Amber and everybody that works there, but I will tell you, it's like working with a family.
It is.
Wow.
And we're
So-
communicating about you. We're making sure we're there for you.
Yep.
So, all right. So let's do this before we get up out of here. Let's do this.
Tell us.
I come into the office, brand new patient. I come into the office and I'm like, hey, this is what I want done. I want to get some of the wrinkles. Now, you know, I want to get some of the wrinkles in my face. I'm speaking as if I'm a woman now.
Okay.
You know what I'm saying?
Okay.
I want to get some of the wrinkles done in my face. I want my breasts to look better, but natural looking. They're kind of small. Want them to be a little bigger, whatever. You know, I want them looking natural. My butt, I want it raised up a little bit, but I wanted to match my legs, right? Start to finish. What is the procedure from that person walking in there and telling y'all this is what they're looking for, to when y'all can finally unwrap the tape and say, yeah.
Do you want to take it?
I'll take it.
Either one.
Walk in. Well, it's going to be a combination. So, because I can tell you from my perspective, and she can tell you from her perspective. So, when you're walking in, you're going to be greeted by our staff. No matter what, they're greeting you by name. Because they're looking at you and like, oh, hey, Mr. So-and-so, Miss So-and-so. And then from there, you're going into a room. You're not getting undressed first. That's a big thing. A lot of people like to undress their patients first from the surgical standpoint. Dr. Sands wants to meet you fully clothed. They want to talk. We want to know your history. We want to know what's happened, what's the changes that's happened in your life.
Mm-hmm.
And then after that, you get undressed. And then we're going to look at everything. We're going to assess everything.
Consult,
we're going to take pictures.
consents.
And the best part that I really do love from a surgical side standpoint is that Dr. Sands takes your own pictures and shows you what you'll look like with your own pictures after surgery. And so you're able to have this visualization of like, oh wow, I can achieve this, I can look like this. And then from an aesthetic standpoint, an injectable standpoint.
Same thing, greeted, come in, bring them to a room. I like to talk first. We'll talk about what you want because, like I said, that wrinkle may not bother them. I'm not going in and say, okay, we're going to do this and this. I give them a mirror. We look at the mirror together and I'm like, okay, what is your problem area? So once they tell me, then I'll go clean their skin. I mark them so they can know like where we're going to place. That's when I mark. I also calculate how much units I'm going to use. When we finish that, I'll make sure that they're numb. So I'll put the numbing cream on and then I'll go mix my Botox or filler, whatever we got to get. And I come back to the room. By the time I do that, they'll clean their skin. Injections done. Once the injections are done, we do another evaluation just to make sure we're good. And then they get an ice pack and I'll go over discharge instructions because what I don't want is somebody to go get Botox and they leave and they put on a baseball cap. Well, you're going to misplace my injections. Like we need to know that. No headbands, none of that.
And so
Exercise always is like, it's a lot that goes into the education behind it because again, you don't want to have filler displaced. You don't want to have Botox moved. It really doesn't spread to other areas, but when I put it in specific areas, I'm putting it there because I want that wrinkle to like phase.
And so from a surgical standpoint, I'm the last person you see before you leave. So I'm talking with you about how your consult went. I'm following up with you how your consult went. And guess what? You don't have to book surgery right then and there because I'm going to follow up with you. If you want a second consult to sit down and talk with Dr. Sands again, I'm doing that. I'm making sure that you are 100% educated before you make any decisions because that's what's important.
So,
And look, that's the same thing with the injections. I want to say that when they come in and do their consult, they don't have to get injections that day. They can always schedule it for a later date.
so here's the.
On the porch.
We on the porch. We are on the porch. Something just happened down there, and guess what? We ain't going down there.
No.
Right.
Look, so just a reminder for everybody that come uptown, that sit on this porch uptown. We on the real porch, and you gonna see some real stuff. You know what I'm saying?
And Twin like, okay, Daddy, where's that?
Well, she know Daddy got us straight. Daddy got us straight right there. But anyway, so the biggest thing that we want to know in this culture is cost.
So So that's
the money lady.
That's
where
the
the money resides.
That's the shocking part. So I'll touch on injectables first. A lot of people don't realize it's affordable.
Okay.
It is affordable for even the college student. It is affordable.
Yes.
So our office is big on loyalty and rewards. So we want to help you help us. So if you want to come in and do things with us, we have Alley rewards, we have Aspire rewards. And so these people are getting points. I'm a points girl. I don't know. I like Chick-fil-A points. I like Popeyes points. I like points at Gap, points everywhere. Everywhere I go, I want points. And so we are truly a culture of that. So we want to make sure that our patients have that. So they have these options. And then for surgical standpoint, Dr. Sands, like I said, he wants to make sure you are doing what's best for you. So we're not going to oversell you on something that you don't need.
And works with your budget.
Always. Always.
And look, if you can't get all the injectables you want because you just all over budget,
yeah,
you can do it in phases.
We break it out.
Botox a day, do your fillers next month.
Yes.
But it is definitely affordable. It is. But again, everybody doesn't need the same amount of Botox.
Correct.
So that's why they need that assessment.
Okay.
Because whereas a younger person who has less wrinkles, I may have to spread it. And it's not a huge dosage amount. But if it's an older person that has strong wrinkles, they're pulling, we may need more. But it just depends. Just come in and see. I'm already calculating yours in my head.
Man, this woman getting ready to stick me anyway. She's ready to stick me, man.
All we got to do is your healthcare assessment.
That's it.
Man, look, I don't know where to end this thing. I don't know how to end this right now. We got so much going on out here today. We got the cops down here fooling with some knucklehead probably. Shay trying to get me in the office to get stuck.
He's coming. He's coming.
She trying to stick my face up.
And we're
Saturday after next. I'll be in office.
We are doing a consult on you. You're gonna walk out with skincare and sunscreen because remember what we said.
I know my bald head, man. Cause that,
yes, seriously.
No, I know. I need to do something with it because when I used to coach football, I used to wear. Sometimes I wear a little visor, and I remember one day I came home, my top of my head was burnt. Everything else was good, but the top of my head was burnt.
People don't think they can get sunburn.
It was burnt.
I keep saying it doesn't black.
I'm telling you.
Oh. So, y'all, if I do decide to go here next weekend and
filming,
see Shay,
right?
Filming.
If I do, I don't know. I'm not 100% sold on this right now. Not
week after
100%.
next, I'll be there week after next.
See, I'm not 100% sold on this right now, but we gonna see.
The next person who's on the porch is gonna be like, oh, something's different about you.
He gonna make expressions and talking. I'll be like, is he real?
Is he real?
What is going on? I don't even see his. But I'll keep you natural. We'll let him see your eyebrows move a little bit.
All those expressions.
You know what, y'all?
We look natural.
Yes.
It's been a pleasure sitting here with Shay and Amber, but I gotta get ready to kick them off my porch. I don't know what they talking about, sticking me with a needle and welcome me in.
We got you.
Hydrofacial.
I was just about to say, you beat me to it. I'm telling you.
You said you wanted to do it.
I know.
I want to see the stuff that comes out.
Me too. That's my joy.
That excites me, right?
I want to see the
compare
derma.
it.
So what about-
Look at this.
But my hair won't be in the way. My beard ain't.
No. We can, because we can still exfoliate through that.
Right.
It really works.
Yeah.
It cleans. Yeah. You're good.
I'm like the J-Lo beauty perk. You're gonna be walking out.
Put him on my list.
I got you.
All right.
I got you.
What y'all think, girls?
They can get hydrofacials too.
Y'all want some facial?
Just saying.
Y'all want facials?
It helps you.
You get a facial. You get a facial.
Everybody gets a facial.
You want a facial? Oh yeah, I know.
Most of the time when I get a hydrofacial, I end up falling asleep. It's so
It's so
relaxing.
relaxing. Chelsea is amazing. So,
Now I'm down for the facial. Putting the little thing on my head, looking like I'm from.
he had the spot.
Oh my God. I protect my hair, so I would need
The
that.
sand spot.
Seriously, you gonna put some? Okay, go ahead.
You know what?
It's time to go.
He kicking us off the porch.
I think he is.
I didn't wait. How y'all gotta let me kick y'all off the porch?
Oh, okay.
Yeah, y'all gotta let me kick y'all off. And y'all just doing it so elegantly. Y'all getting kicked off the porch so elegantly. I don't know how could. Let's see. Okay. Damn, I can't kick them off.
Make your
the porch.
appointment.
You can't.
I can't. How can you kick somebody off the porch sitting up there looking like that?
No, you can't.
See, look. Y'all, look, we gonna probably go. I'm gonna probably take me and my daughters in there. They gonna go get the
Yes.
facials.
It's documented, girls.
They gonna go get the facials for their graduation.
When is graduation?
May 19th.
All right.
See, for graduation, going into high school.
We got you.
They gonna go get the facials. I may get stuck. We don't know just yet.
Y'all get the facials. We're gonna get daddy right.
I gotta
Period.
think about that.
Yeah.
You know what I'm saying? But I gotta think. I gotta do a little bit more thinking on that. But whatever we gonna do, y'all gonna come on in there with me and y'all gonna check it out.
We got you.
Well, once again, man, I want to thank Shay and Amber for coming
This
sit
is
on
fun.
the porch. I enjoyed y'all. Y'all need to come on back again. You know what I'm saying?
Can we go when the sun not so hot?
Oh, Lord.
Now she trying to control my set.
I mean, I'm just saying.
It's the natural.
Yeah.
We got natural sunlight. We got natural
you know
light.
what? Next time,
light.
I'm gonna be ready for the porch. I'm gonna have a head.
Right?
No,
Right.
see, look, I said we was gonna be on the porch. Why y'all just didn't come dressed up like we was on the porch?
I want the people to know.
I am on the porch.
I am on the
Look
porch.
how you looking like she does.
Let me tell you, I want them to get the experience. They're getting the Sands experience.
Nah,
this is what they
man,
get when they
you
come to the office.
This is, I inject people looking like
Hello.
this.
But I'm just saying, y'all could have came with your hair tied back.
Oh no.
Oh, no.
With some jeans on.
Oh, no.
This is when you at the
Some
office.
shorts.
This is what you're getting.
And music.
And
I like to
music.
inject with music. So we just rock on Beyonce.
Beyonce today.
Now, if a patient wants a different type of music, I let them pick.
But I'm saying y'all came on the porch.
Yeah, but
The
we got
porch.
the porch.
Good.
I'm just look
It
how
was
I'm
like a
dressed.
collab.
I feel
It's
out of
this-
place now on my own porch.
Stop.
No, it's the Sands porch today.
Right. We good.
Sands on the porch.
I'm just saying. We really about to get kicked off.
Man, look. Man, somebody do something with these two, man. Okay. But anyway, man, I just want to thank them for coming. Thanks Shay and Amber for coming, man.
We
Y'all
appreciate
dropped
you.
some
Thank you for
real
having
knowledge.
us.
I appreciate y'all coming and sit on the porch. I appreciate y'all having us in the office every this week.
Always.
You wasn't there.
I know.
He
I
coulda-
work my other job.
You wasn't there.
He could have.
Oh, and I also heard you're gonna be at Essence. So guess what? I just scooped Essence. I heard you're gonna be at Essence this year.
Yeah.
Yeah.
I'll be speaking on the panel.
Black girl magic.
I got it before
I'll
they
send you the
did.
details. I'll send you details once everything's confirmed. Time, please. We got you.
And she gonna get me in there? Man, that's my girl right here, man. And she gonna look, come on. Man.
I guess he said we can stay on the porch now because
Oh yeah, y'all got the hookup. Y'all good. Y'all can sit right here, you know.
Sands on the porch.
Brought to you by.
Brought to you by
On the porch, brought to you by.
Sands
Yeah.
Aesthetic Plastic Surgery
Dad.
at Dr. Trey Sands. Follow us.
Yeah.
What?
You just plugging all kind of.
At All Things Shay 1. Follow her. Okay, that was
We
it.
good.
That's it. You
I think I got it.
I think I'm done plugging.
You finished with your shameless
I
plugs?
think I'm done.
You think you done?
Hashtag what?
Hashtag no filter.
You finished?
No, I think.
You finished?
Let me double check. What else would he want me to say? No, I think that's it.
What about the sand snatch?
Hashtag.
Hashtag.
Trademark.
Yeah, the sand snatch. SS.
SS.
The Camaro
Hashtag
SS. You know
There
what I'm saying? The
There we
Trey
go.
SS.
They're Trey SS.
Yeah. Look.
He's not even ready. I'm gonna tell him that Monday. He's gonna be like, what?
Yeah, when you sell it to him, be like, how you got the Camaro SS, the Trey SS. Man.
Yes.
Yeah.
I like that. I like that.
But man, I thank y'all again, man.
Thank you.
You're welcome.
Y'all really came through this. Y'all really came through on this, and man, I appreciate y'all.
I appreciate
y'all,
you. I just want to educate the public.
I know, man. You started off rough. You know what I'm saying? We started off rough. You had that look. Amber was good because she already met me because she was like, but you came in like.
No, I just didn't want the sun really messing
But
up our.
it didn't do nothing.
Thank you.
I know she came.
Shout out to the makeup artist.
She came out rough. Man, hopefully next time you come on, man, look.
You ain't doing this to me. All I said, I needed to make sure that I didn't like
Let me tell you something. We at the end of the day, we still winning.
Right.
Now we out of here. Close my show.
Bye.
We out on the porch. We out. See y'all Monday.
Bye.
I'm gonna have Amber and I'm gonna have Shay with me. See y'all Monday. We out. She with this We Women stuff. Press stop on that thing right now.